The Cancer Institute is probably one of the more significant projects we've taken on in the last 50 years. With the advances that are going on in the treatment of cancer, whether it's through genetic advances, whether it's through technological advances and what that means for personalized care and protocol development, having the Institute under one roof where our clinicians can collaborate, coordinate the delivery of care on an individual basis is more important than ever.
I have a passion for the Cancer Institute. I am a breast cancer survivor. I received services at our existing facilities in 2012, and I could not have asked for better treatment here from all of our physicians, our staff, and our technicians. It was just absolutely amazing. They were so compassionate, kind, and professional, and I just truly feel that it's going to be a blessing to have all of our cancer services under one roof here at Hamilton.
I've been with Hamilton for 18 years, and the majority of that time I have been a Hamilton ambassador. Making the decision of becoming a Hamilton ambassador is quite easy. When you're a part of an organization, a healthcare organization such as Hamilton Healthcare System, your mission, the Ministry of Healthcare, what we do is amazing, to impact lives. So when you have the opportunity to invest into that mission, to that ministry of what we do on a day in, day out basis, and see that in action is so fulfilling.
When you think about, we all have known someone who has dealt with cancer or has affected them in some shape or form. I lost my father 7 years ago to lung cancer without having to go somewhere else. I think that was the most important thing for him, so that he was able to keep his family close. And I think that's what's very important for our folks who are dealing with cancer. It's not just the individual, the patient, it's the family. And the family is doing all they can, and they just want to have the resources they need to help make sure that the life of their loved one is the best that it can be. And so that's why I give.
What we do here is important, but also when we're able to give and have the opportunity to give, it represents to the community that we're more than just a clinical staff working at a hospital. We care more deeply for the community, and we partner with them to make Hamilton Medical Center a first-class organization as far as what we can offer to patients and their families.
It all being together in one place so these people don't have to get out and go from place to place is going to be a whole lot better for the community.
When we talked about why we give, I really put some thought into it, because I was like, why do I give? And then I decided, well, we all want to know where we give our funds to. So what better way to give it to something that we know where it goes to, and it has touched each and every one of us in some way. Any project that the foundation has ever done, if people sit down and look at it, it touches your family. Whether it be the new Cancer Institute or the new ICU that's been opened, it affects each and every one of our families. So why not give to something that we could potentially use one day?
Oftentimes we don't feel like we can make a big impact financially, but when we invest together, we're able to do really, really great things.
Every month, and you can see that and know, I'm giving to something that I can see the results of it here, and especially with the new campaign with the Cancer Center.
Our hospital is very blessed to have the contributors that we do, the benefactors that we do, because most hospitals don't thrive in this current economic situation. So with the economy as it is, we've thrived through the benefit of those donors that we have that provide us community support, and I think we're a very blessed facility for that. I don't think everyone realizes how fortunate we are to have the community support that we have. So I feel like being a Hamilton ambassador is the least I can do to continue to support my hospital as well as my community hospital.
If you're not an ambassador, you should consider being one, because you never know when you're going to be affected. So whether or not you are, for us all to pitch in and do what little will help a lot with all of us. So I think it's a great thing.
The diagnosis is scary, the treatment is scary, and to be able to have a new facility and to just enjoy beautiful surroundings, I think, is a big plus for patients that come in, especially for their first time when they have so many questions and concerns.
Well, I would suggest you give for the same reason that I give, and that would be because I feel like I'm a part of the hospital. I feel like, you know, my family is a part of the hospital, this community is a part of the hospital, and vice versa. This hospital belongs to the community, and so I think we all just need to do our part.
To have it local for our community is just really a blessing. So I want to give, because I give my all to my kids and my family, and this is my family. I'm proud to be an ambassador, proud to be an associate.
Just the love. I mean, I just love it. I mean, I really can't say. I just love it. I love being a part of Hamilton Medical Center. I just absolutely love it. I can't say anything else. I love my job. I love what I do, and I want everybody else to know that this is a great place to be, a great place to work. I love it. I just love it.
Last year, around this time, my mother was diagnosed with cancer. Now, cancer alone is very devastating, and we had to travel up to Erlanger. That's half an hour away from here. Now, you don't think that's a big deal, but when you have to do that every day, you know, drive there, drive back, spend the night, buy food there, it gets very expensive, along with, you know, her cancer treatments.
I personally believe that the mission and the purpose of the foundation is not only critical to the success of the organization, but it's also critical to the community. And I think it's our responsibility to meet the healthcare needs of the community. So giving for me is, I consider it an honor and a privilege to help meet the needs of our community.
And just have the Cancer Institute here available for them, and just help so many families without expense, you know, and just have the person that's suffering from cancer have those people here for them.
It might seem crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here comes that news talking this and that. Give me all you got, don't hold it back. I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. The love is too high, they bring me down. Can't none bring me down. I said, bring me down, can't none bring me down. The love is too high, they bring me down. Can't none bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. got me.